So leading up to the operation is often a really anxious time. There's lots of fear. What's it going to be like? What am I going to look like? How will I cope with this? That's a really normal response as well. And one of the things we actually know that you can do to help cope with that is not think too much about it. Because once you've made the decision to have the operation, then you're going to go through with it.
The prospect of surgery was, in those couple of weeks you had that information that that was going to happen the second time particularly. I don't know, I felt like let's just do it and get it out and, you know, we'll worry about what the outcome's when I get there.
Leading up to the operation, I believe I went into ignore it, don't worry about it, it's going to happen. Sitting at home, worrying about what may or may not happen was never going to be a positive thing. I can't get out of it. Try and get on with my life as I can, as much as I can before surgery, and wait and see what happens afterwards. I was never worried about it, as even though they mentioned death, it wasn't something that was on my mind. My mind was more concerned about vanity. More than anything else, how was I going to look at the end of it? And rather than, is this the end? It was more, how am I going to look at the end of it? And I suppose your face, your voice, and how you interact with people is very much who you are, and all those things were impacted by this one thing.
During those few weeks, I don't know, I was bouncing off how my kids were coping. It's a really funny sensation that you get. I was aware of my children particularly and watching how they were coping with this information, and I was more worried about the kids.
Before surgery, I was told I would have to learn to talk and eat again, but in my own mind, I didn't know if I would be able to do it because they were taking most of my tongue, and the worry is always there that I may never speak again or eat again. The thing I was most worried about was the surgery, not just not being able to talk and eat, but more important than that, I was worried about Ben and the kids and the rest of my family, about how they would cope.
It was a very scary time because Ronald has had cancer of the ear before, and when he came out of surgery they'd removed all his glands and it looked like they chopped his head off, and I wanted to know what they were going to do. So I was always on the internet trying to find bits and pieces, and I'd say to Ronald, come and have a look at this. And you wouldn't, would you?
No.
No, he'd sit for a couple of minutes and then that'd be it. But I needed to know, and I didn't really find all the answers, did we?
No, we didn't.
I went to the internet and Googled adenoid cystic carcinoma, and I did have a look at the procedure with the surgery that was on YouTube, removing the lacrimal gland, and I decided that after a very short time that I don't think I'll do that anymore because I found it a little bit confronting. And I thought it's best not to look at that sort of situation or someone else's surgery, because this is my surgery and it's an individual thing, and I didn't want to fill my head with these images of other people's surgery and their outcomes. So I decided very quickly not to do that any further.
There are lots of things that, you know, we think we should be doing, and one of those is often searching the internet. That's often not a helpful strategy because everyone's surgery is unique. There will be no one else in the world that's had exactly the same surgery as yours. So try not to seek too much information. Try to take yourself for some exercise every day, just a gentle walk, and try not to think too much about what's coming up.
So one of the ways we tried to deal with it was we made sure we didn't stop doing the things we really liked doing. I think on the Saturday before the operation, we went for a walk into Honeysuckle, and Kath said, "Oh, I've never caught the Stockton ferry before," so we made it a point to just catch the ferry to Stockton and back, because we'd never done it before. On the Sunday before the operation, we went down to watch the Newcastle Knights play the Tigers down at Leichhardt in the New South Wales Cup, because Kath loved watching the Tigers play at Leichhardt as a girl. So we just did a couple of things that we really enjoyed doing and made sure we got them in before the operation, didn't we?
Yeah, it was part of the whole rigmarole of the operation was not really knowing what was going to be normal again. So we looked at spending the weekend prior to it doing something together that we had as a memory of something special, and we've continued to try and do that as much as we can while the surgery, after the surgery, you know, radiotherapy, during the whole treatment, we've tried to maintain as much normality in our activities as possible.
Well, when I was first diagnosed, I went to the doctors and went from one doctor to the specialists and that, and when they said that I was going to be operated on the Monday, they asked me, did I smoke? And I said yes. And they said, how many? And I said, lots. Which was true, to a point. Could have been lots and lots. But then the Dr. Eisenberg said, if you stop smoking today, by Monday, which was the Friday, by Monday you will have, I think, 30 to 40% more oxygen in your blood, which will be good for the results of the operation. So I walked out of the hospital, had a cigarette, put it out and quit. One and only time from the time I was 13 that I quit smoking. I still don't smoke.
It is important to stop both nicotine and alcohol preoperatively. Nicotine is associated with increased risk of wound breakdown postoperatively, and that risk seems to be reduced if the patient can stop smoking in the lead up to their surgery. There are a range of smoking cessation strategies, and your GP can certainly help you with those strategies. The risk of wound breakdown isn't isolated to smoking, but it is also a risk factor associated with nicotine treatment. For the purposes of your surgery, the surgical team feel that it is best for you to stop smoking, but also to stop any nicotine treatments at least 1 week prior to your surgery. Alcohol is a far more serious issue. Alcohol use in the lead up to the surgery does have an increased risk of wound breakdown, but also a risk of seizures and of acute confusional states such as delirium in the post-operative period. If you're drinking more than 2 standard drinks a day, we would encourage you to discuss that with either your general practitioner or your surgeon. And certainly anyone drinking above 8 standard drinks a day or 80 grams of alcohol, those people should be advised to stop drinking. However, they should only do so under medical supervision. Stopping drinking at those levels can be dangerous in terms of seizures and of acute confusional states such as delirium, so they should not stop drinking without medical supervision.
I was quite calm on the day that I was having the surgery, and Hoffman sort of came in and said, "How are you, Deb?" And I said, "Yeah, you know, let's just sort of do it and get it over with and see what happens after that." So I was fully informed on what was going to happen and what would happen when you wake up. And so, yeah.
The waiting time while Mum was in surgery was probably the worst 11 hours of my life. Just kind of sitting there thinking, oh, I wonder if everything's okay. And I mean, you just jump to conclusions naturally, you know, you think negative. Well, that's what I was thinking. I was thinking, oh, I hope that she's okay and I hope that she's still alive. And yeah, it was really hard but I don't know if there's anything that you can do to avoid thinking about it, but yeah, I was just sitting at work and just kind of trying to do everyday things. But yeah, it was extremely, extremely difficult to kind of not be in there, and I'd prefer to probably be in there with the surgeons just so I can know what's happening. But yeah, it was very hard waiting.
You just have to keep your day as normal as possible. As much as you want to be in there helping and do whatever you can, the best thing you can do is just let it happen. Let the surgeons, the professionals do their job, because my experience is they have been very good throughout our experience, throughout this whole scenario. That has been very good.
We didn't actually have any contact. We knew that the operation would probably be between 12 and 15 hours. So Ben went to work and we just tried to keep busy. I guess we were watching the clock a lot and thinking, I wonder what's happening. The first we heard was about 9 o'clock that night. She was supposed to go in at 7 in the morning. I think Ben rang the hospital to see what was happening and they said she was still in theatre, that they hadn't taken her in until 9, so it was going to be a little bit longer. So I guess in terms of you know, how we were feeling, when we thought it was going to be over, we knew that it was still going to be another 2 hours, so we were pretty scared, worried. It was good to have the two girls, her sisters, here, because I think that they helped diffuse a little bit of the anxiousness that we were all feeling. We were able to sort of, you know, talk a lot and cry a lot and support each other in that way, yes.
By the time I actually got to see him, some friends did turn up and I had a panic attack. I had a panic, which is not something that I normally do, but as soon as I saw them, I couldn't breathe and I just lost the plot. But yeah, it was lovely to have somebody there then. So you do need people around you, definitely. Don't say, I'll be all right.
The day of Bruce's operation, he was taken away. It was very dramatic and it was a long day. The support I received was through I could ring anytime through the day and they would update me to what was happening with him. The most support I got was from his own doctor, Dr. Cho, who I ran into probably 4 times through the day and pulled me up and spoke to me and told me everything that was going on. And it was a 14-hour operation, so Dr. Cho was there from start to finish, and that was the support through the whole day, was just being able to contact the nurse at the theatre or through Dr. Cho.
While I was waiting for Ron outside the theatre, very stressed, I didn't realise that there was a phone that I could use which would enable me to contact somebody who could follow up where Ron was and what was happening and get back to me. Had I known that that was available, it would have made it a lot easier.
So when you go in for surgery, we often have a fair idea how long the surgery will take, but sometimes it can be quite long, and sometimes it could be unexpectedly long. And usually we'll try and give your family an idea of how long you're going to be away from them for, but we can't always predict beforehand. Hopefully, if the surgery is a long surgery, a liaison nurse could come out and speak with you and let you know how things are going and how much longer to expect the operation to take. But the thing to remember when you're watching this video is that we're offering you surgery because we think you can get through it, and that surgery is going to help you come out the other side. Stay positive, because that's an important part of getting yourself through the surgery. You will get there in the end.